I'd now like to welcome Ross Evans to say a few words about Kidney Wales. So we're fortunate in Wales that we have the support of the charity, and I know there's been a lot happening and new developments recently, so thank you for the update.
Cheers, Sian. I always love listening to a presentation on diet and nutrition just after lunch when I reflect and realise 2 pieces of brownie and 2 pieces of watermelon probably aren't really the most nutritious lunch I could have had before delivering a presentation. So my name's Ross Evans. As Sian has just introduced me, I am the Managing Director for Kidney Wales. I think it's really good for us to be involved on an agenda where many of the presentations have been focused on research, because really taking it back, that's how Kidney Wales were created. That's our origin as a charity. Right back in the late 60s, we were created because a group of philanthropists went to the local hospital in Cardiff and they wanted to support the funding of dialysis machines. Back then, dialysis machines were not as accessible as they are now. And actually, a plan was afoot to produce and put more dialysis machines into the hospital at the time. So they changed their focus and put it into research. And 50 years later, as a charity in Wales, we're still heavily committed to funding research. In fact, last week, I just signed an invoice for £60,000 to support nurse-led research in Wales. But I'm not here to talk about research this afternoon. I'm really here to talk about the support that we as a charity, as a third sector organisation, can offer the kidney community across Wales. And clearly I'm here to talk about Kidney Wales, but I also feel I'm an advocate for the other kidney charities as well. There's a huge amount of resource and support that can be accessed by the kidney community, whether that's through Kidney Care UK, Kidney Research UK, both supporting today's event, Pop and Kidney Support as well. So if it's not through Kidney Wales, there's multiple other avenues of support that you can access. So to start off with, I think it's always important for me to showcase who we are as a team. And that picture up there was taken at the Cardiff 10K back in September of last year. And that is the team. There's 5 of us. We cover all of Wales. We're what you'd call a small to medium charity. Medium stretching it a little bit, I think, when you've only got 5 staff. But you've got myself on the left-hand side, Sam, who's our finance and ops manager. The individual in the middle who's in different clothing to us because she just ran the 10K is Corinne. She's our patient information support manager, our main focus of patient support. Next is Georgia, who's our volunteer and community engagement officer as well. And then Dan on the right-hand side, who's the key person to bring in our income and fundraised monies that help us run and offer this support. And just to add to that as well, it's important for me to share with you that we receive no Welsh Government funding. Like a lot of charities, we don't receive any statutory funding, so we rely on fundraised income, whether it be through grants or events that take place, and members of the public being so gracious to donate to us as a charity. So in terms of patient support specifically, as I mentioned, Corinne is our patient information support manager, and in a nutshell, she's like a one-stop shop of patient support. So you see on the right-hand side there, people will come to us needing support, and it can be a myriad of things that will be offered by Corinne. It could be information and advice, general information and advice on people who've just been diagnosed with kidney disease, just been through the organ donation transplantation process. So information advice that may lead to referrals to the other kidney charities that I've just mentioned as well, from that perspective as well. We also offer financial assistance grants, and I'll come on to those in a little bit more detail in a second. But with the cost of living crisis, it's ongoing. The rise in prices of goods, that's a huge area of support that we're offering at the moment, and I think it's going to grow as well into the future. And connected to that is benefit advice, debt support, and really a huge amount more of support. So when I say a one-stop shop, I don't mean that to belittle it. It's that we can tailor-make the support we offer. So there's various ways that people can get into contact with Corinne. There's a patient inquiry form on our website. There's contact details in the form of a telephone number as well. But Corinne will also go out to the units across Wales as well. As I say, it's a one-person role going across the units. It's sporadic, and to some extent we do try to get across all the units across Wales as much as we can. So I wanted to touch on financial assistance a little bit more and highlight to you what that is and how we offer financial assistance. So we call this direct support. So our financial support goes directly to the patient that's made an application for it. And we have a number of ways that can be offered. So on top right-hand corner, we have financial assistance grants. So far this year to date, we've given out 46 of these. And these are grants up to the total of £500 that are made on behalf of the patient through a renal social worker or another healthcare practitioner, up to £500. And these can be in the form of supporting for white goods, equipment in the house, laptops, support with training to get back into work as well. So far, we've supported 46 people with these grants this year. We haven't declined any, but the governance is that they come through via a healthcare practitioner. We also deliver wellbeing food vouchers. These are vouchers up to a total of £150 for the 4 major supermarkets, and they're really aimed at those who are struggling financially the most. So again, they will come in on behalf of the patient via a renal social worker or healthcare practitioner. £150 voucher turned around very quickly within a 48-hour period out into community, and that individual can go out, use that £150 voucher to purchase some food. And in fact, actually, Lindsay, who's sat in the corner, shared with me from Kidney Care UK how she referred to us someone who needed a financial food voucher, and the feedback they got that it allowed them to go out and purchase some fresh fruit, which they wouldn't be able to do without that voucher. So it just shows how challenging the environment is there at the moment. We've also got carers vouchers for children. They mainly come through the Children's Kidney Centre, again up to £150, but they're sort of like an all-in-one voucher that can be used for a bit of respite, a bit of time out from the day-to-day norm, the opportunity to go for a meal with a family, the opportunity to go to the cinema for a family, have a spa break as well. Just taking that that little respite break as well. And this year we're piloting the same for carers, so adults carers vouchers as well, so for those individuals that are caring for an adult living with CKD. And in terms of some of the figures there, you can see it's a total 183 vouchers given out this year, 183 people supported this financial year. Since April 22, £110,000 we've been able to support directly into the community. And year to date, just under £40,000 of financial support we've been able to give to the kidney community of Wales across all of our grant schemes. And then moving on a little bit, I just wanted to talk about our volunteering and community engagement service, which is run by Georgia. And she's got 2 remits to her role, really. One, the education awareness side of things, and the secondary element is managing our volunteer ambassador project. But in terms of education awareness, what we look to do is put on webinars, information webinars for the kidney community, for patients, friends, family, whoever they may encourage to come along and join. And as you can see, we've delivered sessions on holiday dialysis, again with Kidney Care UK in collaboration. Talking of research, we delivered a session back in the summer of last year around research in general, and what we fund is research with our partners Kidney Research UK. Because a little bit like today, you may have been in the room listening to the presentation on research and going, well, how does that benefit me? Research is up here. There's a lot of money goes into research and the impact isn't seen until further down the line. But I'm really passionate we bring that to the community and showcase why research is needed, because otherwise progression in treatment cares. So I think one of the early presentations after lunch said that a few years ago, there wasn't many treatment options, but research has moved that forward. And our next presentation, our next information webinar that's coming up is on, I think it's on home dialysis on the 10th of March, so we'll be starting to advertise that soon as well. And then finally, really, it's about our volunteer ambassadors. When I joined Kidney Wales 4 years ago, we had no volunteers. Now we've got a good structure of just over 10 volunteer ambassadors. They are individuals that are living with chronic kidney disease or have had a transplantation and organ donation. And what we look to do is go out into the community and through lived experience talk about kidney disease, a health condition, talk about kidney health. And that can be with private organisations, health services, schools, other charities as well even. And that's just a picture of everybody in that picture is one of our volunteer ambassadors at the moment. Because of time, because I think we are running a little bit of overtime as well, I'll skip this last picture and what I was going to talk about, but I was going to talk about how we also like to have a bit of fun, but we were recently at the Organisation of the Year Welsh Charity Awards, but time is short, so I'll skip that. So really, I've just given you a little bit of a whistle-stop tour of the support we offer because time is tight at the moment. But I think it's to highlight that the third sector is there to support. We're there 24/7 essentially. Our websites are there all the time. There's a myriad of third sector organisations that can offer support. Reach out to us, look for us. And if we don't have the answers, we can signpost you into the right direction as well for support as well. Thank you. Is there any questions at all?
No, as I say, I think in Wales we feel very lucky to have you working alongside us with what we're doing in the health service, and then to have you, as you say, in the third sector. And I think the volunteer ambassador scheme is fantastic. I've had some very positive feedback from people who have been in the room when somebody has visited to talk about kidney disease. So I think that's a great initiative.
Yeah, definitely. It is, and there's other elements of support that we offer as well. But in terms of sort of funding equipment for the NHS as well, we all know how challenged the NHS services are financially at the moment. We launched a bit of a pilot before Christmas, £20,000 of funding for equipment that was applied for and was gone in 10 days. So there's other ways that we support as well. But I think the big thing for us is exactly that, Sean, working closely with our NHS colleagues and the other third sector organisations so that we can offer that support as far and wide as possible.